Well, hello, Facebook friends. I just want to welcome you to our live program today. This is the first Sunday in 2018. We're almost at the end of the first week. How are you doing? How are you doing with your goals that you have set? Well, I do hope you're doing well. And I want you to continue to follow us on this live program because I am sure that you're going to be receiving a lot of benefits. And today, let me take time to welcome all of our viewers from all over the United States and all over the world. Welcome. Don't forget to click like our page, and share the video. Well, today I'm going to be talking about fibromyalgia. That's a very long name. Fibromyalgia is described as a chronic musculoskeletal pain disease. Patients will have pain in multiple joints and muscles, and the pain is chronic, lasting for over 3 months. And in the United States alone, we have over 6 million people with this syndrome. And usually when you hear the word syndrome is a group of symptoms. A group of symptoms without any clear diagnosis, without any clear pathology, without any clear etiology. Now, fibromyalgia is more common in female than male. It is said that it affects female about 6 times more than male. The prevalence is about 6 times more than male. And apart from pain in the joints, pain in the muscles, there are other symptoms that can be presented with this disorder. For example, sleep disorder. Patients might feel fatigue. These patients also have mood problem, anxiety, depression. They may have diarrhea, constipation, headache. All these are part of the syndrome fibromyalgia. You know, many times this disease is very difficult to diagnose, as I said before, because patients present with pain, but they have no joint swelling, no joint deformity. There are no clear ways to detect this disease. The X-ray might be normal. There are no lab tests to indicate whether or not this patient has this disease. So therefore, it's very difficult to treat. It is not well understood, the syndrome, but it is believed that patients with fibromyalgia have a central nervous system disorder. The patients are hypersensitive to the stimulus, and their body perceives pain differently from the normal population. And that is why it is very difficult to treat. There are other overlapping diseases or syndrome that can be presented with a patient that have fibromyalgia. For example, chronic fatigue syndrome, irritable bowel disorder, migraine, anxiety, depression. For us to diagnose fibromyalgia, patients usually have 18 tender points. And I'm going to put up a diagram here so you can see where these tender points are. So let's put up our pain diagram for fibromyalgia. You'll see that there are 18 points. We have the pain scattered all over the body, above the waist, below the waist, on both sides of the body. Now, if the patient has at least 11 tender points, then we can go ahead and diagnose the patient with fibromyalgia. Now, the patient is not only tender in the joints, but most time patients present with tenderness also in the muscular area. So there's generalized pain lasting for more than 3 months, no clear reason for the pain, no clear etiology for the pain. Many patients with fibromyalgia will be diagnosed late because it's very difficult, as I say, to pinpoint a cause for the pain. Now, a couple of weeks ago, I was on this live show and I got a message from somebody that said, Dr. Cooper, why don't you speak about fibromyalgia? Because people believe the disease is in our head. And that is the reason why I have fibromyalgia here today. Is it physical or is it psychological? I think at the end of the program, you'll be able to decide whether this disease is physical or whether it is psychological. Now, many people believe the disease is in the patient's head, and some doctors also. Some doctors will say, well, you're moving well, I don't see any swelling, so there is nothing wrong with you. But these patients live in constant pain, generalized pain, pain in the muscles, pain in the joint, pain with movement. Sometimes the pain is debilitating. Some days the patient might have mild to moderate pain. Some days the pain might be so severe that the patient is incapacitated. The patient is in bed. The pain sometimes is so bad that the patient is unable to rest. So then the patient develops sleep disorder. Sleep disorder, lack of energy, mood swing, depression, because the pain is constantly there. Now in medicine, if we can't find a cause, it's very difficult to treat the patient. So because fibromyalgia is made up of, symptoms, and there is no real cause, then it's very difficult to then establish a treatment plan. Now, I'm going to play a video of a patient who wanted to share her story. So let's roll the video so you can listen to someone who actually has the disease. How does it affect that person's life? Let us look at the video. So here we have Rose. Rose has had fibromyalgia for many years. How long have you had fibromyalgia, Rose?
Since I was 47. I'm 61 now.
My, that's a long time. Do you remember what symptoms you had when you were diagnosed?
Yes, I had shoulder pain, arm pain, hand pain, and back pain. That's how it started.
And you had this pain for how long before you were diagnosed?
I had this pain for almost a year before I got diagnosed. I kept going to the doctor and he says, nothing's wrong, until I said, well, why do I have so much pain? And he says, the only thing I can tell you is you have fibromyalgia. And I said, fibro what? And he explained it to me, and he told me
that you were going to be on medication?
That I was going to be on medication for the rest of my life, and that I was going to be in pain for the rest of my life. And it also comes from a lot of stress and or a problem that you had. I took care of my mother with Alzheimer's for 10 years.
And so you were stressed.
And I was stressed, very stressed. And after that is when I got the fibro.
And how are you doing now?
Not very well. It progresses. It comes in stages. It's got 5 stages, and the first stage is mild to moderate, and it keeps going to stronger and stronger.
You mean the pain itself?
The pain itself.
And you're on medication for pain?
I'm in medication for pain and also muscle relaxants. Right now I had to take a muscle relaxant. If not, I couldn't function.
I see. How are you limited in terms of your daily activities?
Very hard. Very, very hard. I had to go and have 4 trigger point injections on my shoulders and my back because I just couldn't function. After that, I get a lot of energy.
After the
injections. But I've got to take it easy because if I overexert myself,
pain returns.
Yes.
All right, very good. How does it affect your family life?
My family life, very bad. Sometimes they call me, Mom, we want to go out. And I say, I don't feel like it. I've got pain. And sometimes they get a little aggravated, but it's also very hereditary. My mom had it, and my daughter has it.
I see.
And my daughter, because of it, got lupus. You could get other autoimmune diseases from fibromyalgia.
I see. Very good. Well, thank you for sharing your story, Rose. And would you like to come on the show to talk a little bit more about your disease?
Yes, I would.
All right. Well, we'll see you soon. Thank you, Rose.
You're welcome.
Well, welcome back. Now you have met Rose on the video. Welcome, Rose.
Thank you.
And thank you for wanting to share your story.
Thank you. Thank you so much.
How long have you had fibromyalgia?
I've had fibromyalgia since I was 47. I am 61 now.
61.
For more than 15 years.
15 years, that's a very long time.
Yes, it is.
Now, how long did it take your physician to make your diagnosis? We know that fibromyalgia is very difficult to diagnose.
It took the doctor almost a year
to
to diagnose me with fibromyalgia.
During that year, were you in a lot of pain?
A lot of pain. I didn't know what it was. I got scared. I thought I had a tumor. And until he finally said, I can't find anything, you probably have fibromyalgia.
Mm-hmm, mm-hmm. How has this disease affected your ability to function?
It affected me a lot. I couldn't function. I couldn't, sometimes I couldn't get up in the morning. Cooking, cleaning was very hard. Mm-hmm. The widespread pain all over my body and tender points that I had to get used to.
Right. Do you have severe pain all the time, or the pain comes with different level of intensity?
It comes in different levels. I get flare-ups. When I get flare-ups, it's like an 8, 9, and I don't get out of bed. Mm-hmm. But when I don't have a flare-up, it's 3, 4, 5, 6, so I can function. Not like I used to, but a little bit better. Mm-hmm. When I get trigger point injections, then I feel good. I feel sometimes like myself, and I want to do too much. I want to do a lot.
Right, right. Most patients with fibromyalgia, they tend to overdo it when they're feeling well, and then they go back into the cycle of recurring pain. Now, tell me, Rose, in order to have fibromyalgia, you need to have at least 11 of the 18 tender points. Yeah. Where do you have your pain usually?
My pain is all my body. Mm-hmm. Sometimes it's my shoulders, my arms, my back, and my waist. Mm-hmm. Sometimes it's in my legs, mm-hmm. and I can't sleep at night. Mm-hmm. Sometimes it's all over my body. Mm-hmm. And it's got 5 stages, so I'm probably on stage 3. That's mm-hmm. what the doctor told me. Mm-hmm. And it gets worse mm-hmm. instead of better. Mm-hmm.
Mm-hmm. What's your biggest challenge with this disease?
My biggest challenge is not doing what I used to do. I used to be very hyper. I used to just go everywhere. Mm-hmm. The everyday cleaning, cooking, being with my grandkids. Mm-hmm. Mm-hmm. And my biggest challenge is
that the inability to function, to do what you used to do.
Right.
All right. Now, do you know how your disease began? Were you stressed? Was there anything in your life that might have triggered this disease?
Well, yes. All my life, I've had a lot of stress. Mm-hmm. If you knew me from the very beginning, my life was a lot of stress. Mm-hmm. I took care of my mother, who had fibromyalgia and diabetes mm-hmm. and Alzheimer's.
So you think the stress of caring for your mother might have triggered the disease?
I think so.
Well, that's a good point.
Plus other stuff.
See, as physicians and scientists, we really don't know the cause or causes of fibromyalgia. But we mm-hmm. know that fibromyalgia can present with other diseases such as stress, depression, irritable bowel syndrome. Do you have any of those problems?
Yes, I do. irritable bowel. I've got a little bit of diverticulitis because of fibro, a little depression, and can't sleep.
Okay.
Can't sleep at night.
Now, how are you doing with your medications? Now, we know that to treat fibromyalgia, we need to look at various different symptoms because since the disease has no clear diagnosis, we have no clear treatment, so we tend to treat symptoms. We treat the pain, we treat the inability to sleep, we treat also the stress or anxiety. How are you doing on your medications?
The medications, what they do is they mask the pain because they don't take it completely away. And when I take my medication, I feel a little better, but I kind of feel loopy also, sleepy. I take muscle relaxants, and that will help me quite a bit.
Let me take some time to give a shout out to some of the people watching us. We have Curtis Brooks. He's saying that he didn't know fibromyalgia could be seen in men, but yes, it is also seen in men, although it's 6 times more prevalent in women. I want to welcome my niece from Jamaica. Robert is there, Rosemary from New York, Perla, Vivian, and all of you that are joining us, welcome. We're discussing fibromyalgia, a very difficult disease to diagnose, a disease that causes chronic pain in just about every part of the body. In the musculoskeletal system, meaning the joints, there's joint stiffness, there's muscle tenderness, abdominal pain, inability to sleep, stress, mood disorder, so many things that are part of this syndrome. But yet as physician, we do not necessarily know how to treat the patient well. So what we tend to do, we treat symptoms. We treat the pain, we treat the inability to sleep, the insomnia, we treat the stress, we treat the abdominal discomfort, but we cannot get to the root causes because we do not know the root causes. And therefore some of these patients are frustrated because one, the doctor sometimes does not believe the patient because there are no analysis, no test that we can do to define whether or not the patient has the problem. X-rays of the joint will be normal. There are no lab tests to detect. So sometimes patients are frustrated because they believe that no one believes them. Let me ask you, Rose, what is the hardest thing for people to understand about your disease? What's the hardest thing?
The hardest thing is that you don't see it on the outside.
Right.
And they don't believe you. And they say, well, you don't look sick. But we know what we feel. And sometimes we get depressed because people don't understand us.
Yes, you know, Rose, many patients with fibromyalgia have that same concern. They look good from the outside, but they are dying in the inside. And many people just look at the appearance and say, well, you look okay. So that means you probably don't have the pain. You're lying, you're seeking drugs. And sometimes as physician, we're also guilty of this because we can't make a diagnosis. You look good, but yet you have a pain that you describe as a 10 out of a 10. Okay? You have joint stiffness, but these are all subjective. And therefore we get frustrated and then we tend not to believe you. And then of course, that's going to cause more pain, more anxiety, and more depression. All right. Now tell me, Rose, how has this disease affect your family?
Well, it affects my family because I can't go out sometimes. I can't join them in activities or parties or and it's also, Dr. Cooper, they're thinking it's hereditary because my mom had it, my daughter has it, my sister has it. And it also brings on other autoimmune diseases like Lyme and
Other diseases?
other MS,
Okay. You see,
lupus.
You see, because fibromyalgia is a syndrome,
Right.
we tend to group it with other diseases that have similar symptoms, other diseases
Right.
that affect the muscles and the joint. Okay, but we don't know much about it. We need to continue to study, not until we get clarification as to the pathophysiology, the causes of the disease, that we can actually treat you well. I know I have a lot of patients who are frustrated
Yes.
because nothing that I prescribe per se, for pain will help. I know that in order to treat the disease well, we have to treat it in a comprehensive approach using pain management, muscle relaxant, stress management, physical therapy, sleep management. Okay? So, Rose, I'm very happy you're here. And how would you advise somebody that might be listening who probably has generalized pain and the doctor is not really focusing on the problem because the doctor can't see anything wrong? There's no objective findings. What would you tell that person?
I will tell that person, hang in there. They're trying to find a cure, and hopefully soon we will have one.
Okay, very good, very good.
And just hang in there, because it's hard. It's very hard to feel this pain and manage the pain. And I know a lot of you out there are going through this, but be patient, because a lot of doctors are working for us.
Very good. Well, thank you so much for being here, Rose.
You're welcome.
I'm going to have your husband come
Okay.
and tell us about the effect this disease has on him over the last so many years. At this time, we're going to roll his video as a means of introducing him, and then I'll have him on the set. Rose, thank you so much for being here.
You're welcome, Dr. Cooper, and thank you so much for talking about this subject.
You're welcome, Rose. So here I have Mr. Barajas, the husband of Rose. His wife has had fibromyalgia for over 15 years. Felipe, how has this affected your family life?
Oof. It's affected us. It has affected me in the fact that I had to take over a lot of the chores, household work that she used to do. She's very meticulous. When I first met her, she was very meticulous, very clean. She was a workaholic. She would go back and forth and back and forth. Gee, I thought I was clean until I met her. But since she was diagnosed with it, she's been steadily going, regressing in her work. Not that I mind, but I've had to take up the slack. And it was a little difficult when I was working and having to go home and help her out. I helped her out with her mom when her mom was alive, and I could see that she was very. She had a lot of. She was very. How can I say? She was stressed, and as her pain has progressed, I see her. There's days when I see her in bed, and I want to do something for her, and I can't. I tell her, I wish I could take the pain away from you. I can't. It's very difficult.
Mm-hmm. So does she have good days and bad days?
Oh, yes. The good days are when she gets her injections, her trigger point injections, and I tell her, take it easy, enjoy it while you can. But because she feels good, she tries to make up all that work that she's missed out on. Mm-hmm. And then 2 or 3 days later, she's back to the pain. She reverts back to those pains. Mm-hmm. I see her taking the hydrocodone, and it hurts me to see that she's taking this this drug that's very addictive. Mm-hmm. And I know that eventually she's going to have to give it up. Mm-hmm. So it's hard to see her going through this.
Right. What advice you have for other spouses or family members who have, people with fibromyalgia at home?
And also what's very difficult is seeing her that she wants to be involved with a family. Mm-hmm. She wants to go shopping. She wants to go cook for the family. She wants to go, and the family wants her to go cook, make tamales for Christmas, make this, and her friends want her to do that too. Oh, and she tries. There, she can be in a lot of pain, but because she wants to uh, make people happy, make her kids happy, uh, and she wants to feel the contentment that comes with helping them. Um,
Then she overexerts herself.
yes, she does.
Okay.
Yes, she does.
Well, fibromyalgia is a disease that has no cure. So thank you so much for sharing your story, and we'll see you on the show. Thank you, Felipe.
My pleasure.
Well, here we have Mr. Felipe, the husband of Rose. And for many years, you have experienced fibromyalgia with Rose. So I want to welcome you as you share your story. But before I get you into the program, somebody was asking, Curtis was asking, if you're exhausted all the time.
Yes, I also have CFS, which is chronic fatigue syndrome. Yes, I'm exhausted all the time.
And what do you do to relax, or do you do any particular exercise? Somebody asked that question.
As a matter of fact, I do. I meditate. Meditation and prayer is very important, and that's what I do. I sit down and pray and meditate by yourself in a room, and that'll help.
I'm very happy you brought that up, because with this program, we try to approach the patient in a holistic manner. That means the physical, the spiritual, and social. Now, meditation is quite helpful in many diseases. Studies have shown that people who meditate, people who pray, tend to do better in terms of disease processes and longevity than someone who doesn't pray or meditate. So that's very good that you brought that up.
Yes.
Okay.
And also, Dr. Cooper, diet.
Of course, we're going to talk about that pretty soon. Okay. So she's mentioning diet. So diet, exercise, stress management, meditation, all of that. That's part of the total man treatment, which I promote here on Get Health with Dr. Cooper. But I wanted to bring in the spouse. Now, your wife has been diagnosed with this disease that has no treatment, no cure, essentially. How does this affect you at home?
Well, that means I have to carry the load. I have to do a lot of the work that she normally does. I do it now, the laundry, and since we're living in a 3-story condo, I can have her coming up and down the steps because it's very difficult for her. Aside from having fibro, she has bad knees. So whenever she has a good day, which are days that she doesn't have as much pain, I tell her, relax, come down, do nothing, sit there, enjoy yourself.
So you're a very supportive husband, right?
Oh yes, I try.
So
I try
from your
hard.
experience, you can see that the disease is actually real, because you're telling me that she has physical limitations, right?
Oh, a lot of physical. There's a lot of things she can do that she was capable of doing before. Yes, there's a lot of things that she cannot do.
How does it affect your family togetherness, this disease?
It affects them because, or rather, they want to continue doing the things they used to do before. All the cooking, all the grilling, having to do a lot of the cooking because they like her cooking. She can't do that. She has to hold back, and I see the hurt in her that she can't accomplish this simple task that she was able to do before. The family wants to go on an outings. She'll say, I can't, I'm hurting, I have to stay home.
Right. And does she have good days?
Oh, there are days. The days that she has them, there are days that she has gotten injections. They'll last 3 or 4 days at the max, then the pain comes back. But those 3 or 4 days, she's ready to go, and she wants to work.
Right. So the injection that Felipe is talking about, it's steroid injection, in which patient gets temporary relief from the anti-inflammatory effect. But as she mentioned earlier on, and as Felipe is mentioning, the effect lasts for just a couple days. So in reality, this chronic pain disease has really no true treatment because, as I mentioned before, we do not know the cause. So it is very debilitating, very stressful for the family because most time the patient does not get any pain relief. How would you advise spouses and family that might be listening or watching us? How would you advise them to care for their family member with the disease?
They have to stay cool, calm, and collective. They have to be understanding. There's going to be days when they'll burst out in anger. That's where the cool part comes in. Understanding is knowing what the spouse's their medication, what they're taking, and also on days that they can't do anything, be there for them.
Yeah.
You can massage them, but you have to be careful because you touch them and it hurts.
That's right. That's a very good point. The support is important, but you have to know how to support them. Because as you mentioned, touching. These patients are very hypersensitive to touch. And touching can also produce pain. Remember, we spoke about all these tender points. So
Yes.
as you mentioned, touching will also produce pain. But I have a listener here that suggests, he asks about how about music therapy? That's Curtis Brook. Music therapy. Have you tried that?
Meditation, music, yes, that calms you down. And there is, it's called RIFE, R-I-F-E, for fibromyalgia, and it helps a lot. You could find it in YouTube, on YouTube.
Okay. I do believe in meditation, relaxation, and stress management. Because when the patient is less stressed, then the pain seems to be lessened.
Yes.
With the anxiety and extra stress, then the body itself will produce cortisol. And these negative hormones that will attack the joints and the muscles and cause more pain.
Yes.
So for the listeners out there with fibromyalgia, you need to realize that the disease has really no cure per se. But there are many things that you could do to suppress your pain. One of those, relaxation. Meditation, as she mentioned, whether you use music, you listen to inspirational readings, you reflect to the Bible. Also, physical medicine. It could be hot and cold bath. That's going to be quite helpful. Okay, exercise is important. Exercise is medicine. You know, increase walking. As much as you can tolerate, walking will increase the production of endorphins. Endorphins are called the happy hormones that will put you in a relaxed mood that will also suppress the pain. So exercise is very, very important. I want to thank you. Is there anything else you want to tell our audience before we take another short break?
No, not at this moment.
All right, I want to welcome some people who are joining. Erica Allen, Amanda Boxhill. I see here Martha Cipriano, George Williams, Elizabeth, Maggie Yu, Deborah. There's so many people. I'm not going to go through all the names, but I want to welcome you to the show, and I would like you to share the information you're receiving. Press like. And for more information, if you really want to stay healthy, then you can go to my website, www.drdonacooper.com. There you'll find many resources on nutrition, on health, on meditation, how to live a happy and longer life using less medication. At this time, we are going to use food as medicine. So let me move over to my cooking video. I want you to take a good look because remember, food is medicine. So let's go over to this next section. Welcome to Get Healthy with Dr. Cooper, a program designed to educate you on healthy lifestyle for you to improve your health, prevent diseases, or reverse diseases. Today, as you look at my table, I have 2 trays of very colorful vegetables. You can see I have squash, different color squash. I have broccoli and cauliflower and other vegetables here. Now, when you choose your plate should be colorful because different colors bring in different nutrients, vitamins, and minerals. This is a very easy dish. It's all in one plate. You'll have your vegetables and your protein in the same plate. Now, if you don't like these vegetables, feel free to choose whatever vegetable you and your family like. We're just going to toss them together like this. Toss them all together. I'm using here 1 medium-sized squash, another medium-sized squash, yellow squash, and I'm using some broccoli, and of course potato. This potato has complex carbohydrate, so your sugar should not be elevated if you are diabetic. And I'm going to be using some cauliflower. Cauliflower and broccoli, they're high in antioxidant and good to prevent cancer and heart disease. Now for the protein, I'm going to be using some tofu. And I'm using hard tofu that you just cut in cubes. Now to that, I'm going to be adding 2 tablespoonfuls of good oil. This is grapeseed oil, high in omega-3. I'm using 2 tablespoonfuls. And then I have some onions here. Let's put our onions. So we're going to put our onions already cut. And then to that, you can add whatever spice you want to add. Now for the salt, you're going to add 2 tablespoonfuls of soy sauce. We're going to get that in there, 2 tablespoonfuls. Now for the spices, feel free to add whatever spice you like. So if you like Italian seasoning, add some Italian seasoned spices there. So we're going to add some of this. Now for me, I like garlic and I like onion. So I'm going to put my garlic and onion there. So we're just going to put maybe a teaspoonful of each. Okay. And then I also like Mrs. Dash. It's non-salty. So we're going to add some of this. And any other spice you like, you can add that. Then you're going to toss this all together. Get everything mixed properly. And then you are going to pour that in a tray or in a dish, Pyrex dish. All right, so we're going to pour this out here. And make sure everything is properly stirred together so we can have the spice all over. Nicely done. All right, you can continue to stir. Make sure it's evenly distributed. And then you're going to bake this at 350 for an hour. Now I have some already prepared for you. So let's look at the finished product. Very delicious, multicolored, different vegetables bring different minerals. For more recipe, don't hesitate to go to gethealthwithdrcooper.com or cooperwellnesscenter.tv and visit us on Facebook. I'll see you next time, same station. All right, so we just established the fact that fibromyalgia causes generalized pain and tenderness, and that fibromyalgia affects women more than men. And given the fact that we do not have any real cause for fibromyalgia, it's very difficult to treat the disease. So we treat the pain, we treat the depression or the anxiety. But I just showed you here food as medicine. Now, one of the best ways to protect yourself against any disease at all is actually the food you eat. It is believed that food is the number one risk factor for so many diseases. So why not empower yourself to fight diseases? How do you do so? You use healing foods. Healing foods such as plant-based food, lots of vegetables, lots of fruits, lots of grains, lots of nuts. And Rose, you mentioned that you have also changed your diet.
Yes, I have.
How do you feel now that you're eating more fruits and vegetable, nuts and seeds?
A lot better. It gives me a little bit more energy. Turmeric, also spices.
Yes.
Turmeric is very good for inflammation, because we get a lot of inflammation. And
So you use a lot of turmeric then?
yes, I do.
You know, cayenne also, cayenne pepper. So turmeric, cayenne pepper, these are wonderful for inflammation.
Oh.
Okay, so they fight inflammation. And of course, if you want to build your immune system, then you can also add ginger, a lot of citric fruits like oranges and lemons and so forth. That's going to build your immune system so your body is more capable now of fighting diseases. Now, you also mentioned exercise. You're telling me that there's some exercise you're unable to do.
Yes, you can walk half an hour. I walk half an hour 3 or 4 days. Sometimes I can't. Sometimes I can. But a lot of exercise, like sit-ups, jumping, no jumping.
Right, because of the pain.
Right.
But you know, exercises like, as you say, walking, anyone can walk. And walking 30 minutes or more per day, at least 6 days a week, is helpful. Now, walk at your own pace. Because if you try to rush, you might have more pain. So walk at your own pace. Also, stretching.
Stretching,
Stretching
yes,
the joints.
yes.
That's very important.
Very important.
Right? So
Yes.
you can walk and you can do stretching. Because remember that fibromyalgia will cause joint stiffness and inability to move those joints. So some of the exercises that are going to be beneficial will be stretching. So I recommend that, you know, if you're listening to me and you have fibromyalgia, then stretch, because that's going to give you more flexibility and decrease your risk of inability. All right, Felipe, have you been assisting your wife with any of these exercises? Why not?
Yes, I have. We spend a lot of time walking the dogs.
Very good.
I understand that you have to keep a constant pace, but for her, stopping every once in a while when we're walking the dogs helps her. And we usually do that 5 times a day.
Oh, that's good.
Yeah, 5 times a day, and probably about 20 minutes each time. The only exercise that I can help her with, I bought a total gym, but she can't use it.
No, of course, that's too much for
It's
her.
way too much.
Right,
So
right.
it's not going. That doesn't do anything for her. But the only thing that will help her are very light massages.
Okay, very good.
That's about it. That's about all I
The
can
glider.
Glider.
Glider
you use
is
the
good,
glider too.
yes.
Because anything that has to do with mobility,
Right.
moving the joints will be quite helpful.
Right.
So, all our new listeners, I want to welcome you to the show. And remember, we're on every Sunday at 6 p.m. Central and 7 p.m. Eastern Standard Time. I would like you to press like and share our page, subscribe on our YouTube channel, because our intent here is to educate you and empower you to live a happy, longer life. There's so many diseases that your healthcare provider are unable to discuss with you, to educate you on. I do believe that we empower our patients through education. It is so difficult to take away, half an hour extra when you go to see the doctor. So this is a place that you can learn how to live healthier. I have several courses online. If you go to my website, drdonacooper.com, you will see 40 Days to Amazing Health or Transformation to a Healthier You. These courses are online. They're accessible anywhere in the world once you have a smartphone or a computer. So don't hesitate to go there. And remember, we're here for you. Today we're discussing fibromyalgia, a disease that is very difficult to diagnose. We are not sure how long this disease has been around. Somebody asked that question. However, we know that our patients are suffering because we take a long time to diagnose the problem, since there are no clear abnormalities, whether physical or lab or x-ray. So most of these patients, they suffer for a while. So fibromyalgia is generalized chronic pain of the joints and the muscles. There are about 18 tender points, and if 11 of those tender points are positive, then the patient is diagnosed with fibromyalgia. Treatment is difficult, and that is why we're here with Rose and Felipe to discuss how to approach this disease. If you're listening to me and you think you have this disease, then go into your doctor and discuss the possibility of testing your tender points to see if you have 11 or more. Remember that the disease is also associated with other symptoms: inability to sleep, fatigue, tiredness, mood disorder, constipation, headache. There's so many other factors that go along with this disease. So how do we treat the disease? Well, in this case, we're only treating symptoms. We treat with pain medication, we treat with muscle relaxant, we treat with anxiety medication, depression medication, because we don't have clear pathology, clear etiology, and it makes treatment very difficult. Rose, what else would you like to share about your disease with our viewers?
What I want to say is share, 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 because I want to thank Dr. Cooper for bringing up this topic of fibromyalgia, because we are so many that need to be heard. Thank you so much,
You're
Dr.
welcome.
Cooper.
You're welcome.
And it's hard to manage fibromyalgia, especially with loved ones. And what I want to say is just have patience and share, because I want everybody to know that you're not alone.
That's right. And that the disease is not really in your head.
No, it's not.
Most
it's
people
real.
believe that the disease is in your head.
Yes.
It is not real. But as Felipe discussed,
Yes.
that when you are in pain, you can't climb the stairs.
No.
When you're in pain, you're unable to carry out your daily activities, and then he
Yes.
has to support you.
Yes.
So spouses or family members, if you have a family member with this disease, remember, it is really not in the head. It is a real disease. These patients are just hypersensitive to stimulation, and the brain does not process pain stimulation well, and that is why they have such a degree of pain. So support them. Don't let them feel that, you know, they are mentally ill. The disease is real. Guys, I want to thank you for being here. Before you leave, we do have a video on exercise, simple exercise that you can use it at home to relax those muscles, to flex those joints if you have fibromyalgia or any other pain disorder. So let's roll our video on exercise. Active living is important for strong bones. So this time, I'm going to take you over to Christopher and Rebecca with Living Active segment.
Thank you, Dr. Cooper. Good morning. This is Living Active. My name is Rebecca Huerta, and this is Christopher Hanna. We're going to go ahead and be showing you an at-home workout that you can do from the comfort of your own home, because we all know that maintaining a daily workout routine is crucial in maintaining a healthy lifestyle. So the first exercise we're going to do is we're going to get you warmed up. You're going to want to go ahead and jog in place for about 2 to 3 minutes. And once you have completed those minutes, you're going to go ahead and do some calf raises. You're going to raise up about 20 reps until you get those lower body nice and warm. And then we're gonna go ahead and do 20 air squats. It's very important to get your whole body warm before doing the workout because you don't want to get hurt. And then we're gonna go ahead and show you 3 exercises. The first exercise is gonna be a kettlebell lunge with a twist. You're gonna go ahead and hold the kettlebell with both arms, you're gonna lunge and you're gonna twist. But when you lunge, you wanna make sure that your knee does not go past your toe because that can cause an injury. And when you twist, you wanna go ahead and engage your core, make it really nice and tight when you twist. We're gonna wanna do about 3 sets of 30, and then we're gonna move on to the next exercise, which is going to be a kettlebell front squat. Now you're gonna go ahead and wanna hold the kettlebell from this side and go ahead and squat down. And you're gonna keep your toes pointed out just a little bit so you can go ahead and squat and make sure again that your knee does not go past your toe. Then we're gonna do 3 sets, about 20 to 30 reps for this exercise. And this next exercise that we're gonna do is going to be a squat with a twist. You're gonna wanna go ahead and squat down and you're gonna bring your elbow to your knee. And you're gonna do that with the other side as well. But also you wanna make sure that you go down nice and slow and you get up and you go ahead and twist. All these exercises are working out your lower body, but it is also engaging your core. So you're working out 2 muscles at the same time, which are the biggest muscles in your body, your core and your legs. And when you finish, you want to go ahead and make sure you stretch out any tightness you feel, drink plenty of water, make sure you take plenty of breaks that are needed throughout the workout. Now thank you. This is Living Active. Now back to Dr. Cooper in the studio.
Thank you so much, Christopher and Rebecca. We're going to be very active this week with those exercise routines you've given us. At this time, we'll take a short break. Don't go away. We'll be right back with more information on Get Healthy. Now, if you're just joining us, we're discussing fibromyalgia, a disease that affects 6 million people in the United States. Disease affects both men and women, but more common in female. The disease presents with a generalized pain in the joints and in the muscles for a period of more than 3 months. A disease in which there are other symptoms that could be associated, such as poor quality sleep, mood disorder, constipation, diarrhea, hypertension, stress. The disease has no etiology, no pathophysiology, and therefore it makes treatment very difficult. There are so many patients who are frustrated because the diagnosis is made late. And therefore, a couple of weeks ago, Rose sent me a message on Facebook and asked us to present the disease. And therefore, I invited both of them, and they have given some very, very important information about the disease. So if you have fibromyalgia and you need some help, then send us a question. Put the comment there on Facebook. And also, if you would like us to discuss another topic, then also send me the message. Now, Felipe, you were talking about the difficulty you have at home, because when Rose has the pains, then most of the work is left on your shoulder. Am I right?
Yes, that is very true. This is where the spouse has to really pick up the ball and run with it, because if he doesn't know how to cook, he's going to have to learn. Mm-hmm. If he doesn't know how to do laundry, mm-hmm. he better learn. Because when the spouse sees his wife, and sometimes the husband, you feel bad.
Yeah.
I mean, you feel bad, you don't know what to do. Mm-hmm. And as a spouse, I tell her, don't do anything. Just stay calm, relax.
And you take over.
I'll take care of it. Mm-hmm. Mm-hmm. You want me to, you need something? Let me go get it.
Right.
No grocery picking for you. She wants it. Whenever we go buy groceries, she'll want to get some bags. Says, nope.
So you're a loving husband. Then.
Oh,
Yes, he is.
Well, yeah, I do hope all the spouses out there that are watching, if your wife has fibromyalgia, just give them a lot of love. All right? And Rose, you did mention in your previous comment that meditation has helped you well.
Yes, it has. Meditation has helped me. I even have a group that we get together every month, and that helps a lot. Muscle spasms, meditate. When you have pain, meditate. Pray, 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 because it helps.
Very good, very good. And of course, you're on multiple medications, right?
Yes, I am.
But as you mentioned before, most of these medications are not that effective.
They're really not that effective. They mask the pain. I'm trying to get off of the
Most of your medications.
most of my
You don't have to miss
medications,
them.
weaning off of them. And believe it or not, the main one that I thought would take away my pain is the one that made me feel worse now that I'm weaning off of it.
Right, so there's no
feel better.
magic pill for this
No,
disease.
there's no magic pill.
So as I mentioned before, if you want to empower yourself to fight this disease, then you have to think in a comprehensive approach. Use the pillars of health. One thing is that you need to have your goals. Identify your goals. All right, now prior to my disease, I used to do this. But now with the disease, I need to cut back. So you have to adjust your goal. Number two, you need to spend time outdoor. Get in the sun. Walk. Enjoy fresh air. Vitamin D is important, and just 10 to 15 minutes of sunshine per day will increase your vitamin D level by 1 to 2,000 international units. So sunshine is important. Now you have heard about water. Water is medicine.
Yes.
Water is important for lubricating the joint. Your body is made of 70% water. So when you're dehydrated, there's so many symptoms you're going to have. One, constipation. Two, muscle ache. So if you consume enough water, what is enough water? One easy way is to take your body weight in pounds, divide it by 2, and that's the number of ounces you need per day. That's important. And of course, getting enough rest. I know that poor quality sleep and insomnia is a part of the disease. So how do you ensure that you get enough rest? One, stay away from caffeinated drink. Caffeinated drink will cause insomnia. All right? So don't drink any coffee in the afternoon, or take it out of your diet altogether. You can drink a herb tea, something warm, so you could sleep well. Okay? When you get to bed, turn off the lights, because in the darkness our body produces melatonin. Melatonin will cause drowsiness and allow you to rest and sleep.
Yes.
I should also mention that sunshine also increases the level of serotonin. Serotonin will then produce a peaceful mood, a wakefulness, and will suppress the anxiety and the depression and the mood problem.
Vitamins.
Vitamins.
I started taking magnesium. A lot of fibromyalgia patients are low in magnesium. I started taking it and I felt better.
Yeah, magnesium and calcium. But
Calcium.
you know, if you're eating or consuming a balanced diet, most of these nutrients you'll get from the diet.
Yes.
For example, calcium. Green leafy vegetables are high in calcium. So if you were to consume, you know, every day abundant amount of green leafy vegetables, and make sure you also have colorful vegetables, that is going to give you enough nutrients that you need to fortify your body against some of these diseases. Another factor that is important to suppress pain and to boost your health is social connectedness. How is your relationship with your family?
Very good, as a matter of fact. I call my children every day, my grandchildren.
Yes.
Socially, we're doing very well.
Right. So social connectedness
Yes.
is important for good health. Studies have shown that people who have a good family relationship tend to live 4 to 10 years longer than those that are isolated.
Social family, social church, social friends.
Yes, there is a relationship with the spiritual health and the physical health. Patients who have a church community tend to be healthier.
Yes.
Mental health problems will decrease, anxiety decrease, overall health is improved. So all these are very important points for you who want to live a longer and happier life. So remember the points we have laid out, and if you want more information, stay connected with us every Sunday at 6 p.m. We're here, 6 p.m. Central, 7 p.m. Eastern Standard Time. Leave me a comment, share the information, and remember to visit my website for more health resources, drdonacooper.com. Guys, I'm so happy you were here today.
Thank you for having us.
Thank you for having us.
And I hope sometime I can get you back.
We'll come back.
Maybe we'll talk about another disease.
Okay.
Yes.
I want to thank you, Facebook friends, for watching us. Remember, this is the first Sunday of the year. I am willing to walk with you on your journey to amazing health and longevity. If you have comments, if you need support, then reach out to me and I will be there to walk with you. So long, Happy New Year, and I wish you abundant health. Until next week, bye-bye.
Bye.